2014, there were approximately 3,500 sudden unexplained infant deaths in the United States.
What is SIDS? According to the CDC, SIDS is the death of an infant less than 1 year of age that occurs suddenly and unexpectedly, and whose cause of death is not immediately obvious before investigation.
SIDS is a leading cause of death among babies between 1 month to 1 year, and it occurs more between 1 month to 4 months of age.
Here's some myths about SIDS.
Do cribs cause SIDS, also known as crib death? No, cribs alone do not cause SIDS, but other features such as a soft mattress can increase the risk of SIDS.
Babies who sleep on their back will choke if they spit up or vomit in their sleep. Actually, babies automatically cough up and swallow the fluid that they spit up or vomit. It is a reflex to keep the airway clear. Studies show no increase in the number of deaths from choking among babies who sleep on their back. In fact, babies who sleep on their back clear fluids better because the way their body is built.
If parents sleep with their babies in the same bed, they will hear any problems and be able to prevent SIDS from occurring. Because SIDS occurs with no warnings or symptoms, it is unlikely that an adult will hear a problem and prevent SIDS from occurring. Sleeping with a baby in an adult-sized bed actually increases the risk of suffocation and other sleep-related causes of infant death.
The term SIDS may sound scary, and the death of a baby is always heartbreaking, but there are a number of ways to lower the risk of SIDS. Learning about SIDS and safe sleep for babies is very important for all caregivers, not just parents. Anyone who will be taking care of your baby should learn simple steps in reducing the risk of SIDS. These simple actions may make a huge difference.
If you have any more questions, log on to the National Institute of Child Health and Human Development and search for SIDS.
This is the CSU-Pueblo Nursing Department signing off. Okay, so I have the discharge orders for Carla. I was just wanted to reiterate the importance of teaching her about SIDS when you go in to do your discharge education. Okay?
All right, thank you.
I'm going to go play golf. I'll see you.
Hello, Mrs. Paredes.
Hi.
How are you?
Good, how are you?
Good. My name is Amanda, and I'm going to be your daytime shift nurse today, and we're going to go over your discharge paperwork and also review some information about a safe sleep environment for your baby.
Okay.
Okay.
Hi, Carla. My name's Sam, and I'm a nursing student at CSU-Pueblo, and I'm just here to help Amanda with your education.
Okay, cool.
All right. So first thing first, are you aware of SIDS?
Yes, we talked about it in the parenting class I took.
Nice. I'm glad to hear that. Well, one important thing is to always remember when you're putting your baby to sleep, lay them on their back.
Okay.
And you may also think that a car seat is a really safe place to put your baby, but it's actually not because baby's neck muscles aren't strong enough. So when baby leans forward and they can't pull their head back up, so they can actually suffocate. So when the only time to put the baby in the car seat is when you're in the car.
Okay.
And also, the only safe place for your baby is in their crib alone on their back. It is important to remember that co-sleeping increases the risk of SIDS, but however, you can do room sharing.
What is room sharing?
So room sharing is when there's a bassinet in your room, so you can put baby to sleep in the bassinet, but you don't put baby in the same bed as you.
Oh, okay.
Also, the only thing that should be in your crib is a hard, firm mattress. And make sure that there's no bumpers, no toys, no blankets, and no pillows or other soft objects in the crib.
But what if my baby gets cold at night?
Well, whatever temperature you're comfortable at, your baby will be comfortable as well. You should put your baby to sleep in just a onesie or a sleep sack.
But make sure you don't overdress your baby because that can also increase the risk of SIDS.
Okay.
And you always want to make sure that you're coherent too, so never smoke or drink around your baby.
Okay.
Do you have any other questions?
Actually, I do have some questions. I wrote it down earlier. Does breastfeeding help reduce SIDS? Is it okay for my baby to go to sleep with a pacifier? And also, I've heard about those like monitors that monitor the baby's heart and oxygen. Do those work? Should I invest in one of those?
Those are some really great questions. Breastfeeding does help reduce the risk of SIDS, and it's okay to give your baby a pacifier as long as it's clean and dry and not attached to any strings.
Okay.
But before you introduce the pacifier, you want to make sure that they're breastfeeding well.
Okay.
And the products that you're talking about on the market that claim to monitor the heart rate and oxygen, there's actually no research or events of detecting or reducing SIDS. But a baby monitor is different than those products in that a baby monitor lets you see the baby and you can hear the baby when it cries when you're in a different room.
Oh, okay.
Any other questions?
So I should never put my baby on its stomach?
It's okay for you to put baby on their stomach for short periods of time when they're awake and when they're being monitored. Tummy time actually helps strengthen the neck, shoulder, and arm muscles, and it also prevents soft spots from happening.
Oh, okay.
Anything else?
No, I don't have any more questions.
So here's a handout that has the information that we just went over with you, and there's also a safe environment checklist on it on the back. And
okay, thank you. I will definitely be using this.
All right, thank you. Enjoy your new bundle of joy.
congratulations.
Thank you.
Thank you guys for watching this video. It was brought to you by Colorado State University Pueblo nursing students, myself, Carla Paredes, Amanda Zalzar, and Samantha Yoder. We would like to give special thanks and credits to
The Nursing Stimulation Lab,
Pueblo City County Health Department,
and the Education Department.
Thank you guys for watching.